Hello, my name is Joe Gross, and today I'll be performing a assessment on a patient that has experienced some trauma. So first I'm going to put on my BSI and make sure that I'm kept safe. And then as I'm approaching the victim, I'll be assessing the scene to ensure the safety of me and the victim. And the scene looks safe, so as I'm approaching, my general impression here so far, it looks like we have one female who's maybe like about 20 years old, I would guess. And the mechanism of injury seems to be, I don't really know at this point, but I'm considering that. And so it looks like I'm going to have to call 911. So I'm going to go ahead and do that, and then going to gain consent to care for this victim first. So hello, I'm an EMR, can I help you?
Yes.
Okay, she's responsive, she consented, so I'm going to, first I'm going to consider stabilizing her cervical spine just in case there's any injury there. And so then I'm going to go on to check my ABCs. So I'm going to look in her airway to check that it's open and clear. And then I'm going to check for breathing to see that it's adequate and check the quality of her breathing. And so I would do that by checking equal expansion of her lungs, and then I would go on to circulation and see if she's losing blood anywhere. So with my gloves, I would go ahead and just gently touch her whole body, and checking my gloves and checking to see if there's any blood anywhere in her body. And I would go around her whole body. I would expose, looking for blood anywhere, and go behind her, making sure my hands touch to get, entire coverage. And go everywhere, check for blood. Look in her pant cuffs and her socks. I would probably take off her socks. And look here too. No blood, so I'm going to continue. Also, I'm going to expose, lift up, expose everywhere. And so I don't see any blood here today, but I would be checking for that. And then I'll check a pulse to make sure that she does have a pulse. Make sure she, yep, and I do see a pulse. So that concludes my ABCs. That's the priority. And then, as needed, I will reassess the ABCs throughout this whole procedure. And so I would continue by finding out what her chief complaint is, to know what the main problem is here that I would be looking for. And so after that, I'm going to go ahead and, let's see, it's trauma. So I'm going to do a physical assessment next, the whole head to toe, more thorough this time though. So I would once again feel her head gently to check for any broken bones possibly, and check for deformity, open wounds, tenderness, swelling, or sounds that might be occurring due to injury to her body. And so I'd be checking for those dots, symptoms all through here, and check for cerebral spinal fluid in her ears and her nose. And then I would check her eyes for tracking, make sure there's no head injury there. And then I would check to palpate her facial bones to see if make sure there's not any occlusion to the airway from a broken facial bone. And then, let's see, then I would go on to her neck. But first though, I would look in her mouth to check no broken teeth or anything like that. Oh, and I would smell for a fruity odor, to make sure, see if there's any diabetic problems maybe. And then I would move on down to her neck. I would check for any jugular vein distension or any tracheal deviation that might indicate some lung problems. And then I would palpate all of the cervical vertebrae and feel them to see if there's any dots, symptoms there as well. And then I would feel the clavicles separately. I would expose here and feel the clavicles, and then feel the shoulders and the shoulder girdles, and I would push down gently and pull in gently. And I would ask the patient for it to tell me at any time if anything that I'm doing causes pain. And then I would check the sternum here, feeling for any deformity, open wounds, tenderness, or swelling once again, to feel for any broken bones or anything like that. And then I would check for any for resistance for breath. I would kind of push in a little bit to make sure she's adequately breathing. And then I would go ahead and expose her midsection and then palpate the 4 quadrants here. And checking for any like swelling or firmness in the abdominal region. And I would go ahead and check her hips, or her pelvis here. I would pull in, and then I would pull apart to see if anything hurts in that area. And then I would verbally ask if she has any problems with her genitalia area, and continue on down the body. And then, so I'll be palpating pretty firmly to feel if there's any bone disalignment, and also the dots still, checking for that. And then I would come down here and I would check both legs. I would do that to both legs. And I would be checking for CSM, circulation, sensation, and movement, as well as bilateral strength. I would compare the two legs all the way down and make sure there's no unequalness. And so, let's see, I would check capillary refill. The socks would be taken off at this point. And so I would check the capillary refill, check to see that she can feel what I'm doing here, her sensation there. And I might as well check for a pedal pulse to make sure there is one here too, so I can estimate her blood pressure. And and then have her do dorsiflexion and plantar flexion to make sure she has strength here. And then I would go up to her arms and do the same thing here, and palpate the bones, make sure I can feel, checking for dots here as well. And then check capillary refill, maybe check her pulse real quick too, just make sure there's adequate blood flow down there. And then I would do the same thing on this arm, and then have her squeeze my hands together to check for strength. And then I would go on to check her skin color, temperature, or moisture. And then, yep, this feels pink, warm, and dry like it should be. So circulation, sensation, and movement. Like I said there, again, I would do that in her arms as well, these upper extremities. And, okay, so then I will demonstrate a proper log roll to check her back here. So I'll gently place this arm up, and place this arm over. It's rolling here to the uninjured side. And then, like I said before, I'll be considering C-spine this whole time. So if I have any bystander, I would have them help me here, but I don't today. So I'm just gonna stabilize C-spine by myself, and I'll roll her slowly and gently this way, stabilizing her C-spine, and then propping the victim up with her legs so that she can stay here. And so then once again I'll expose, maybe cutting away the shirt if I have trauma shears or something, and feeling each vertebrae, feeling for dots here as well. And then check her butt area, check the back of the legs just one more time, see if there's any bleeding that I missed before. And alright, so that'll conclude the physical assessment. Then I'm going to go on to ask about the medical history. So I'm going to say the sample acronym and then OPQRST as well. So I would ask the patients any signs and symptoms of her chief complaint. And then I would ask how the onset of this happened. Was it sudden or gradual? And then what palliates or provokes this symptom? What makes it better? What things make it worse? And then the quality of the pain. Is it sharp or burning or stuff like that? And then I would ask if the pain radiates from anywhere, any other place in the body. And the severity of it from 1 to 10. How severe is this pain? And then I would ask, at what time did this happen? Then I would go back to the rest of the sample. So I'd ask if she has any allergies to medication, foods, plants, animals. And then I would ask what medication she is taking, either recreational or prescription or non-prescription or over-the-counter, anything like that. See if she's taking medication. And then I would ask her past or pertinent medical history to make sure she didn't have any recent hospital visits or something I should know about. And then I would check SAMPL. I would check her last oral intake to see if she had any medication recently or last time she had food. and check her output, the last time she went to the bathroom, all that stuff. And PLE. Now check the, ask her the events leading up to this injury. And yep, so that should conclude my medical assessment. Then I would know all that information about her. And I would continue to monitor her vitals. Actually, I'll get the vitals right now. I'll go ahead and get those baseline vitals to compare them later. Okay, so the patient seems comfortable here, so I'm just going to go ahead and leave her in this position for now. And so, by checking vitals, I'm going to first start with her level of responsiveness. I already know she's a responsive patient, but I'm going to go through the AVPU questions and find out if she knows, ask her the person, place, time, event questions to see what her responsiveness to all those are. And then see if she's responsive to pain, and see if make sure she's not unresponsive. And then I would proceed to be checking her heart rate. Rate, rhythm, and quality is what I'm looking for here. And then I would check her respiratory rate, rhythm, and quality as well. And then I would be thinking, like I said before, the skin color, temperature, and moisture. I'll go ahead and do that again now just to make sure that she's pink, warm, and dry. And if not, I would be noting all of these abnormalities. And then before I checked the pedal pulse, which would let me know that her systolic blood pressure is about 90 millimeters of mercury. But I could go ahead and do that again now, just to see if anything has changed. And then I'm going to check her pupils, that her pupils are round and equal size and responsive to light as well. And I did the tracking already earlier, so I can maybe do that again. But so now I have vitals. So I'm gonna, if I did find any injuries throughout this assessment, I would be treating those injuries appropriately. Say if I have to do a splint or something like that. And then I would treat for shock, maybe elevate her legs if she has no leg injuries or something. And I would continue to monitor her vitals. And I would stay here until the paramedics arrive. I think that concludes my EMR assessment. Thank you.